Good morning. Good morning, everyone. My today's presentation topic is dentifrices. In dentifrices, we will see the history about dentifrices, the definition of it, types of dentifrices, its composition, and its a review of literature, advices we give to the patient. And in a brief, we'll see a disclosing agent and about plaque and ideal properties of disclosing agent, composition and mechanism of action, and the dyes which we use and the method of application. Coming to the history, dentifrice was used as early as 500 BC in both China and India. Modern toothpaste were developed in 80s. Alum was an earliest used substance. In 1892, Dr. Washington invented toothpaste tube, and in 1942, BB did first clinical trial of fluoride toothpaste. Coming to the definition, according to American Dental Association Council on Dental Therapeutics, a dentifrice is a substance which is used with the toothbrush for a purpose of cleaning the accessible surface of teeth. Webster described the term dentifrices as derived from dents, which is tooth, and phrices, that means to rub. Different type of dentifrices are there. Basically two types, the cosmetic dentifrices and the therapeutic dentifrices. Cosmetic ones are effective in removing the extrinsic staining that occur on a tooth surface, often the end product of bacterial metabolism, and it ranges from green to yellow to black. And the therapeutic dentifrices, they must reduce some disease process in the mouth, such as caries, gingivitis, calculus, or sensitivity. Coming to the application of dentifrices, amount of toothpaste or gel needed for effective cleaning is a pea size on a top half of the toothbrush, and dentifrices should preferably disperse in between the bristles rather than on its tips. Children under 6 years of age should only be given half amount of dentifrices as compared to that of an adult. Then coming to composition of dentifrices. First is abrasive agent, which can be a calcium bicarbonate or calcium phosphate. It forms the bulk of toothpaste. It helps to polish toothpaste, it helps to polish the tooth by eliminating the calculus and soft deposits, as well as food particles which are stuck on the tooth, and it depends on the hardness of abrasive. The external hardness of abrasive, size of abrasive particle, and the shape of particle stains. Next is humectant. It can be a sorbitol. It can be a sorbitol or mannitol, the substance that prevent drying of toothpaste and maintain wetness, and to maintain a consistency of toothpaste, and it act as a preservative agent such as sodium benzoate. Glycerin is a humectant. The next is detergent, which is sodium lauryl sulfate. It is a cleaning agent. The foaming action of detergent aids in removing the food debris. They have several disadvantages. This agent, which is present in a toothpaste, it can be irritating to mucous membrane. It may cause nausea, reduction in keratinization of epithelium, denatures the protein, and 7.5% of sodium lauryl sulfate produces inflammation of oral mucous membrane. Next is sweetening agent, which is saccharin. Sweetening agent, it is added to make paste suitable for use in mouth. Then next is anti-plaque and anti-gingivitis. A stannous salt such as stannous pyrophosphate and a zinc citrate to maintain the gum health. Then next is antibacterial agent, which is triclosan. This agent is effective in reduction of supragingival plaque and the supragingival calculus and gingivitis. And along with this agent, anti-tartar agent and anti-carcinogenic agents are also included, which are the tetrasodium phosphate and the disodium dihydrogen pyrophosphate. This pyrophosphate are the crystal growth inhibitor, which help in preventing the calculus formation. It retards the formation of calculus and the caries control because of its fluoride content. A next agent is fluorides. Compound of fluoride are known to strengthen the enamel by remineralization and making teeth more resistant to acids produced by bacteria. Stannous fluoride or sodium monophosphate are commonly fluoride compounds. Next is a desensitizing agent. Fluoride agents have been claimed to have a desensitizing properties, and they are contained in specialized dentifrices, example stannous fluoride, and the non-fluoride agent, which are commonly used in a desensitizing agent, including a strontium chloride, potassium nitrate, and a sodium citrate. Few other ingredients are potassium nitrate, which are used as a desensitizing agent that blocks the unpleasant sensation from reaching to the dental pulp. Then sodium carbonate, peroxide, or hydrogen peroxide. Toothpaste claiming to whiten your teeth usually have this ingredient, and the herbal ingredients such as they claim to be hypoallergenic due to the presence of natural ingredients instead of chemicals. The first fluoride containing toothpaste approved by FDA was this Crest Pro Health. Then coming to review of literature, Bibi et al. In 1947 found that the fluoride compounds to be incorporated in dentifrices and the enamel solubility taste have shown that the effectiveness of water-soluble fluorides, such as sodium fluoride, is diminished when used in the presence of certain dentifrices, which constituents such as calcium carbonate, dicalcium phosphate, or similar materials. It was found that dentifrice containing 0.76% of sodium monofluorophosphate with mixture of 42% insoluble sodium metaphosphate and 5% of dicalcium phosphate gave relief in 66% of individual teeth and of the individuals. Coming to the disadvantages of fluoride containing toothpaste. Fluoride containing toothpaste can be acutely toxic if swallowed in a large amount. 15 mg per kg body weight is actually lethal dose, and 5 milligram per kg may be fatal to children. It causes nausea, vomiting as an immediate symptom. Coming to the review of literature, Disava et al. In 1989 found that the triclosan in a solution and dentifrices, a steady state was reached by day 7 with the blood level in the part per billion range and urine as a main route of excretion. Based on these studies, triclosan can be considered as a safe for use in dentifrices and mouth rinse products. Davis RM et al. In 2004 found that triclosan or a copolymer dentifrice significantly improved the plaque control compared with the fluoride dentifrices. D. Hugh et al. In 2005 found that the dentifrices containing triclosan copolymer or the sodium fluoride provides effective control of oral malodor up to 12 hours. And a C. Sizzler et al. In 2015, it can be concluded that there was a minor and a most likely clinically significant difference between triclosan and a stannous fluoride containing dentifrices. Then coming to the advice for the patient, parents should make sure a pea-sized portion of fluoride paste is on a child toothbrush and remind the child to rinse and spit. In case of gingival recession, dentifrices with minimal abrasive particles should be used. Then coming to the plaque disclosing agent, according to WHO in 1978, definition of plaque is it is a specific but a highly variable structural entity which resulting from a sequential colonization and a growth of microbes on the surface of teeth and the restoration, consisting of microbes of various strains and species are embedded in an extracellular matrix composed of bacterial metabolic products and substance from a saliva and blood. Another definition by Bradshaw and Mars in 1999 is dental plaque is a microbial biofilm, a diverse microbial community which is found on a tooth surface embedded in a matrix of polymers of bacterial and the salivary origin. Then coming to the identification of dental plaque, elimination of bacterial plaque from a tooth surface is essential for maintaining a dental health. It is often difficult, however, to convince a patient about the importance of performing a thorough oral hygiene. Patient motivation, therefore, represents an important aspect in improving the oral hygiene. Coming to the definition of disclosing agent, according to Rabin in 1943, a disclosing agent is a solution which, when applied on the tooth, makes visible by staining the roughness and a foreign matter on a tooth. According to the World English Dictionary, a disclosing agent is a dye in a liquid or a tablet form that colors something, especially on a tooth, to show a plaque. And then we can motivate the patient to use a dentifrice. Coming to its history, Skinner in 1914 used the first disclosing solution, which is the Skinner's iodine. Patients' teeth were disclosed with this solution to demonstrate a soft accumulation which had to be removed by the patients at home. Berwick's in 1920 found a combination of brilliant green crystal violet. Islick in 1935 found a Bismarck brown, and Rabin in 1943 found a gentian violet, which is a non-iodine dye. Coming to utility of disclosing agent, for diagnosing the dental plaque, for personalized patient instruction and motivation, self-evaluation by patient to evaluate the effectiveness of oral hygiene maintenance, and for preparation of plaque indices. Then the ideal properties of this disclosing agent are taste, it should be comfortable to patient, flavored, and should encourage the patient cooperation. Intensity, it should be evident contrast to differentiate from a surrounding environment so that the foreign substance and the plaque can be easily differentiated from a tooth surface. Then next is duration of intensity. It should be enough retentive that the color should not rinse off with the ordinary rinsing methods for a short period of time, which is required to complete the instruction or the clinical examination. And it should be non-irritating and non-allergic and antiseptic property. Coming to composition, there are different combination of dyes like FDC, which is red number 3, and FDC blue number 1, and FDNC blue number 2, and so on. Then coming to mechanism of action, disclosing agent work by changing the color of dental plaque so that it contrasts with the white tooth surface. Dental plaque has the ability to retain a large number of dye substances which can be used for disclosing purposes. This property is retained to interaction because of the polarity differences between the components of plaque and dyes. The particles are bound to the surface by electrostatic interactions and the hydrogen bonds. That means the particles are bound to the proteins in the plaque with the help of hydrogen bond, and that is how it disclosing agent color the dental plaque. Then coming to the different dyes which are used in a disclosing agent: iodine preparation, mercurochrome preparation, Bismarck brown, merbromine, erythrocin, fast green, and a fluorescein, two-tone solution, basic fusion, and the three-tone gel. Then the first is iodine preparation. It is the Skinner's iodine solution or a diluted tincture of iodine. In a Skinner's iodine solution, the iodine crystal 3.3% and the potassium iodide 16%, zinc iodide 10%, and a distilled water 16%. And in a diluted tincture of iodine 21% and a distilled water 15%. Then an iodine-based solution, it stained plaque as a brown to black and inflamed gingiva as a dark areas. Discoloration disappears in a few seconds. Advantages are it is low cost, it is low in cost and clinical photography. Then the disadvantages are patient allergic to iodine. We can't use iodine-based solution in such patient, and objectionable taste. Then coming to the mercurochrome preparation, mercurochrome solution of 5% and the flavored mercurochrome solution. There are two different types. In first, mercurochrome 1.5% and a distilled water 30%. In flavored mercurochrome solution, mercurochrome 13.5 gram and a distilled water 3 ml and a bit or 2 to 3 drops of peppermint. The next is Bismarck brown, Bismarck 3 gram, ethyl alcohol 10 ml, glycerin 120 ml, and an anise for flavor for 1 gram. Then merbromine 450 milligram, oil of peppermint 1 drop, and a distilled water of 100 ml. The next is erythrocin. It can be used for rinsing or it can be used in a way like rinsing or direct topical application, or it is available in the tablet and a vapor form. And by rinsing, it contains a 10 ml of alcohol, 100 ml of distilled water, and 2 drops of peppermint oil. And for topical application, it consists of erythrocin 0.8 gram, alcohol 10 ml, distilled water 100 ml, and a peppermint 2 drops. And in tablet and vapors, it again contains a flavoring agent, white oil or calcium stearate, sodium sucralate, and sodium chloride, and the erythrocin. However, with the regular use of FDC red number 3 tablet, it becomes abundantly clear that the pleasing shade of red adversely affects the utility of wafer. The plaque interproximally and at a gingival margin, especially in the posterior areas, could not easily be seen because of the poor contrast between the gingiva and the stained plaque. Accordingly, the use of red disclosing dye reveals that the red is wrong color, since the plaque that has been stained red is extremely difficult to see due to poor contrast with the oral tissues, especially in the back areas of a mouth and in between the teeth. It should be noted that it is these precise areas which are most prevalent site of caries and periodontal disease. And coming to advantages of this atheroscent red, it does not stain the dental equipment or clothing permanently. It does not stain the composite type of restoration permanently. It does not have any known possible side effect or that iodine and a mercury stain causes. The next guys are the fast green and the fluorescent. And another disclosing agent is a two-tone solution. And the basic fluorescent and its method of application. Then coming to the conclusion, this study shows that a total removal of root deposit during an osseous resective surgery is never obtained with the conventional instrumentation. Clinical limitations and a visual deficiency could be primarily responsible of a present result. In order to overcome these obstacles, the use of plaque disclosing agent during resective surgeries seems to be effective. Through this observation, the post-operative clinical parameters remains to be assessed in order to evaluate the attainable advantages that affects both recovery phases and a long-term periodontal health. Such observation would constitute an interesting starting point for a future experimental studies on this subject. These are the references. Thank you.